Dr. Aysam, can you tell us what are the strategies that are used by pharmacists or used by you to manage conditions such as nasal congestion, all the respiratory diseases related to climate change? What type of strategies you are using?
Yeah, actually, first of all, we put this in our mind, the climate change. We try to go deeply how much it affects the physiological, the pathophysiological, or even for the disease. And we try to educate the patient, try to diagnose more preciously what's the reason the patient complain, why he is complaining from this. So it's not only like before, only like a virus, bacterial, that's it. No, we should consider always that there is effect of the climate on the airway, as we discussed before. And that may be the reason why the patient is suffering from, for example, long-term nasal congestion. Very simply, if we go back to the physiology of the nose, as we discussed before, if we go back to the how the nose can deal with this exhausting climate, exhausting changing in the air that can be offered to the lungs. That may be a good idea for any doctor to think about it before he take a decision to give any medicine for the patient. Excellent. Or to put the correct diagnosis.
Yeah. So, doctor, do you think you are seeing more of the, you are with the non-pharmacological management or with the pharmacological management?
If you are talking about non-pharmacological treatment, you mean that the herbals or that the alternative medicine. Actually, from my point of view, we don't know too much about this alternative because we don't study deeply. There is different people who can answer the question, but we can ask the patient some advices to activate or make their immune system more active, to stay away from the effect of the environmental changing.
Yeah.
That's better than go for only medicine, because it's a long effect on the airway, not like a short period effect. So as Dr. Rawad said, we are facing a lot of changes now. We need to deal with it. We know that the human being can modify his lifestyle. Even the immune system can modify to affect or to face this changing, but it will take some time.
Yes.
So we need to educate the patient. So always education may help more than medication for this kind of issue.
Do you think, doctor, the education towards using, for example, devices for asthma, let's say inhalers?
Exactly, that's one example for that.
And do you think patients have difficulty usually in using those inhalers, using the nebulizers, using based on your clinical practice?
Yeah, that come the roles of the physician and even the pharmacist to teach the patient how to use this. I'll give you like a small example about the nasal spray.
Yeah.
Every day I face a problem with a patient who is using nasal spray, and he is telling me, doctor, I'm using the nasal spray more than 3 weeks, but I'm still have a stuffy nose. So I have like a sample in front of my desk. I give the sample to the patient, tell him, please try to use it now.
Okay, show me.
So when he show me, put like that, put spray, stop. It's not the right way. So the patient always, why nobody tell me?
Of course.
So the problem starts from educating the patient. The patient will not go through any like a website to know how he uses the nasal spray.
Yeah.
He will use it with the way that he see others using or what he think that it's right.
Yes.
So that's the role of the doctors and the physicians to give the good information from the good sources.
Yeah.
Don't let the patient take it.
That's why intercollaboration is very important.
Yes.
Interprofessional collaboration between the physician and
exactly.
the pharmacist to have a better outcome and to minimize all the complexity that might occur with the treatment, as you mentioned.
We don't let the patient go to the net and find out how to use this. No, because the net is full of actually wrong information more than right.
Misleading information.
So that's very important for us to lead this population how to go to the right way. There is a lot of examples using the nasal spray, how to use the medicine, how to keep the medicine in a proper way, how to discard the medication after you finish from using it. There's a lot of things we need to highlight it to the patient. We need to inform the patient the same information that we know about even allergy or common cold or like any disease. He should know from our point of view, not from others, because we are the leaders in this problems. We need
professional expertise.
We need to give him what's the right, what the wrong. We need even to inform the patient from day one. Listen to me, my patient. This is the story that you go through. You have 7 days of this 1, 2, 3, 4, 5. You should expect that. Stay at home for 2-3 days. Don't go to your work to not spread your Bed rest is number 1, number 2, number 3 of treatment for any virus infection, and this always the patient actually don't care about it.
Which is?
Their bed rest.
Okay.
For any virus infection. They think that I'm working online. Okay, you're working online, but you're working 12 hours. You need to sleep. Your immune system is waiting for you until you stop doing your daily activity, then he start work. So who will kill the virus? And always we face this problem.
The immune system is the key.
Yeah. So you need to help your immune system. I cannot help you. I don't have some patient visit us, doctor, tell me, doctor, I start feeling some symptoms today. Tomorrow I have a very important business trip. I need to be cured tomorrow. I inform him, I'm not a Superman. I'm not a magician. If you expect that from me, please, you can cancel this visit. I cannot help you. You need to help yourself. Your disease doesn't know that you have a business.
Of course.
And when this patient he is not listening to us, go to his business trip, or even, for example, a child go to the school, or the parents send the
he will spread the virus everywhere, and it will be
2 days ago, there
disaster.
is a very, very exciting example. A mother come with a 12 years old son. He has a very active coughing with an active upper respiratory infection. I'm informing him that, okay, you need to stay home. She said, no, doctor, I have 2 twins at home. You have 2 twins at home, but he has more than 40 kids at the school.
To spread
he will
the
meet.
virus too. Yep. Yeah.
So
this
stay
is a very
at home.
important point.
You see these points?
I agree 100%. Well,